I'm Dr. Linda Gromko, and this is Transgender Medicine Made Simple. Today we're talking about, can non-binary individuals take hormones? Well, the short answer is yes, of course, non-binary individuals may benefit from gender-affirming hormones. That's the short answer. So treatment goals for non-binary individuals are very important to define. As in anything medical or surgical, or for that matter, anything in life, the most critical thing is to define exactly what it is that you want and be as specific as you can in communicating what it is that you'd like to see happen. Surgeries are better defined than hormone treatment. So examples, there is one of the non-binary options is what's called the smoothie, and the smoothie is also called gender nullification, which offers a non-gendered appearance of the mons pubis and the perineum. There's also a new surgery that's called the penis-preserving peritoneal pull-through vaginoplasty, and this offers a person to retain their penis but also creates a vaginal opening. More examples. It's possible to do breast reconstruction, that is to say augmentation or top surgery with or without nipples, depending on what a person wishes to see happen. And then in the vaginoplasty realm, we now have the no-depth vaginoplasty, which enables an individual to opt for penetration or no penetration. But it's a nice example of something that can be modified according to a person's individual needs. But with all of these surgeries, you can see that a person knows exactly what they're going in for and exactly what they're going to come out with, of course, after some recovery time and barring complications that were not foreseen. So with hormones, though, you can't anticipate everything. For example, you cannot anticipate how much change you'll see, and you can't anticipate how quickly that change will happen. Let me give you a couple of examples here. So supposing that you wanted to take estradiol to augment your breast development. Well, in estrogen, most people will find that if they take estrogen, that they're going to develop into about a B cup after several years. But maybe you're the overachiever and you develop far more breast tissue than you had originally intended. Now, what can you do? You can stop the estradiol, of course, or you can reduce the dose. But you could also have breast surgery to reduce the breast size and change the shape. So this could be, for example, a breast reduction surgery or also a top surgery. Now, what if you were taking testosterone to masculinize and you appreciate the muscular development and you appreciate the lower voice, but your facial hair happens to come in quickly and it's really abundant, but it isn't what you had hoped to see happen. You knew it could happen, but it's coming in quicker and with much more abundance than you had hoped. You can have electrolysis hair removal or laser hair removal, but you wouldn't have chosen that particular effect of the hormone. Now, it's important for you to know which hormone effects are permanent. It's easier to plan with surgery because the results are well defined and they are permanent. You know, one time I was counseling a young person and I was saying, now remember, the results of this surgery are permanent. And this kid looked at me and said, well, isn't that the idea? And yes, it is the idea. With hormones, though, be sure that you know which effects are likely to be permanent. So a voice drop with testosterone, for example, is permanent. Breast development with estradiol is generally permanent, although it may change in shape a little bit. And facial and body hair development are permanent fixtures. Now, does this mean that you shouldn't be taking hormones if you're a non-binary individual? Not at all. It doesn't mean that for 1 minute. But here's some things that might help you get what you want to see happen. First of all, know what it is exactly that you want to see happen just as precisely as you can. Communicate this precisely with your healthcare team. Be sure that your hormone provider is not making assumptions about what you want based on what other people may have wanted from their hormone use. And be sure to meet with your hormone prescriber regularly to evaluate the hormone effects and modify your dosing as needed. That's the information I have for today. I hope it was valuable to you. If so, please like this video, share it with someone else who might need this information, information, and please subscribe to my channel, Transgender Medicine Made Simple. Thank you for watching, and I'll see you in the next video.